Here we go. Second to last one here. This is on your Parkinson's, which Dr. Baker will have covered your Parkinson's with you, and you've read in your textbook, and also hopefully you have watched, or you will be watching this week, your the NCLEX prep on the Parkinson's, which should be helpful. I just highlighted here that the dopamine no longer inhibits the acetylcholine, which is why you have this extrapyramidal, hard trouble with that word. When dopamine decreases, the chemical imbalance and cholinergic or the excitatory cells dominate, causing this extrapyramidal actions. So there is no cure. The medications try to decrease the symptoms and improve as much of the quality of life as they can for as long as they can. So you've seen this picture before. What I want you to focus on, you have in Pearson, page 958 to 960, there's a table that talks about the drugs. Also, Karch, chapter 24. Focus on your dopamine, your levodopa, which mostly it's levodopa, that's the mainstay. It's a levodopa combined with carbidopa. The carbidopa helps you use the levodopa, or their brand name is Cinemet. That is the mainstay. Also, there's amantadine that is used, which increases the release of the dopamine. Amantadine is an antiviral. It only works as long as there is dopamine to be released. Any of these drugs on this side, the type 1 drugs, including the inhibitors over here, but I'm not going to test you on these inhibitors. Stick to the amantadine, the dopamine, the levodopa, carbidopa, or Cinemet. I want you to focus on that side. They're all associated with the development of melanoma, so it would be contraindicated if a person has history of melanoma or some dark lesion. The potential for a cancer, contraindicating lactation, and if they have an allergy to the drugs or ingredients. Caution in hypertension, arrhythmias, if they've had a heart attack, myocardial infarction, bronchial asthma, peptic ulcer. Also think of contraindications for anticholinergics because of the stimulation of the dopamine receptors, because that applies here. The drug-drug interaction to keep in mind is if vitamin B6 or phenytoin are taken with your levodopa, levodopa, carbidopa, or amantadine, it decreases the effect of the levodopa. So you teach them to not take avoid all over-the-counter vitamins. Also, a significant interaction with MAO inhibitors. They can go into a hypertensive crisis, so they have to be off the MAO inhibitor at least 14 days before they can go on the levodopa, carbidopa. And on the right side of this chart, the type 2 drugs are your anticholinergics. I just want you to focus on your benztropine. You will find in your Karch textbook, in your levodopa, read your prototype in your Karch textbook on page 413. Now your anticholinergics, your type 2 drugs, are in Karch page 416. Your anticholinergics oppose the effect of the acetylcholine receptors. There's caution in hypertension or hypotension, dysrhythmias, and hepatic dysfunction. It's contraindicated in narrow angle glaucoma and allergies. Adverse effects, of course, are your anticholinergic effects. Disorientation, confusion, memory loss, agitation, nervousness, delirium, dizziness, dry mouth, nausea and vomiting, constipation, paralytic ileus, urinary retention, can't see, can't eat, can't pee. Also, for your benztropine, there is a prototype in your Karch textbook on page 417. And that's what I want you to focus on, is just what I've touched on. And that's the end of this recording.